I don't know whether it's a myth versus reality or something like that. So using Ayurveda, can they be completely cured or they have to be supplemented by the modern medicine?
Totally incurable. Okay, we cannot do anything in that. Which category he or she falls in, that makes a lot of difference.
Modern medicine also, after they are paralyzed, they give up at some point. So can Ayurveda restore their health,
Yes.
or can it help?
So anything which is dominant in earth and water is good for you in this season.
And external that you have mentioned is the application of oil.
We always say that pain is due to Vata. So if Vata is not there, pain is not there. So what happens when you walk in the barefoot, the chillness from the tiles in the winter season actually affects your legs. So that stiffness comes. And when stiffness continues for some time, you get the pain. Ayurveda has told that if you are getting exposed to the cold wind excessively, it can lead to facial paralysis. We call this ardhitam.
Hello hmtv viewers, welcome back to our Ayurveda talk show, Ayurveda Parampara. So we have with us today again Dr. Paritosh Bhatt, who explained us about Ayurveda, its concepts and how to tackle winter season. So let's again speak to him in detail. Thank you so much for being again with us, sir.
Thank you, ma'am. And it is always a privilege to be here and talk about Ayurveda.
Sir, last time we have spoken about nourishment and the approach to winter season and all that. So for the viewers who have missed the first time, so can you explain about nourishment in a nutshell?
Yeah. See, I will tell you one basic, very fundamental and basic concept. Okay. So Ayurveda always believes that there are five, bhutas, or Pancha Mahabhuta we say. So we say there is ether, then air, then fire, then water, and then earth. So anything which is dominant in earth and water is good for you in this season. Okay. So what it can be, earth and water. So something which is very nourishing, so which is oily is nourishing. Sweets are nourishing. So when I say sweets, it does not mean that you go and eat laddus every day or you go eat cakes every day. I'm not saying that. But sweet in the sweet taste, like milk is sweet, madhura in Sanskrit. Wheat is sweet, rice is sweet. So all such preparations are good in this particular season. Apart from that, we have discussed that there are other things which nourishes, like dates are there, ghee is there, milk is there, dry fruits are there. Specifically, sesame seeds are there. So sesame means til, we say.
Til,
So sesame is very good in this season. Apart from that, various chickpeas we discussed, that is very good in this particular season. Vegetables are very good because lot of various kinds of vegetables are available in this time. So you can eat everything which is good. Certain parts of India, we also use certain other flours like bajra, ragi. We use makai, that is corn. So all these flours also can be used. And the second way of doing nourishment is we discussed is externally. So externally we can apply oils. This is one of the simplest thing. You can do a self application of oil, and if possible, and if you have feasibility and availability, please go to some Ayurveda center. You can come to Kapil Ayurveda also. We can do some external therapies like massages there, steams is there. Some other therapies like Shashtik Shali Pindasveda is there. So all these therapies done in this season will help us to cope up throughout the year.
So sir, like you have mentioned, nourishment is both internal and external. So internal, like you have mentioned, these chickpeas and various kinds of flours that we have, and again, getting rid of junk is really important. And external that you have mentioned is the application of oil. So that has to be done religiously. So I think our audience have gotten a good idea
Basic
on what,
idea,
yeah. Sir, and we see that, winter season along with it brings many diseases and, common ailments like cold, cough, and those who have these chronic pains in their shoulders or neck or legs, so that gets aggravated. So what's your take on the situation?
See, it is true because in winter season the pain increases. We have seen a lot of people, specifically old age people who already have some joint pains like arthritis is there or some other pains are there. So they will start saying that, oh, my knee is paining more. So can I do something about it? So it is very common in winter season because of the fact that in winter the chillness increases, the shita, the coldness, it increases. So we always tell one thing that shita is stambha. Stambha means obstructing or it is something like arresting. It stops the movement. the flexibility, softness will stop. So even muscles flexibility and softness is also compromised during this time. You have noticed, if you sit in an air conditioner for a long time or high AC is there, after some time you will feel little stiffness in the body. Okay? It is because of the cold wind, cold and dry wind. So in winter season also the cold and dry wind is there. So that affects our system. So we always say that in this particular season, Ayurveda actually they have explained in the books where Hemanta Ritucharya is told. So Hemanta is a word which is given to winters and early winter. And in Hemanta Ritucharya it has told that you have to use everything which is warm. So you have to cover yourself with the warm blankets, you have to use the jackets, you have to use certain herbs and paste which is warm in nature. One of the very famous and very known thing is called as agara. Okay, so agar, it's also available in the form of itra, you know itra, the small bottles where perfumery is. Yes. So this original agar perfume, if you actually apply, you will feel warm.
Okay.
So it can be that good. So Ayurveda has advised all those things to keep yourself warm. We have to remember that Ayurveda is not written some few years before. It is written thousands of years before. And thousands of years before, we do not have any artificial way of heating the system. We don't have heaters, we don't have air conditioners. So in modern times, we can use the modern things which can take care of us. So in this season, pain will definitely increase because of the climatic conditions, and it is important that person keeps themselves warm. Okay, so even if you are sleeping, if you have knee pain, ensure that your knees are warm. So you can just put some blanket or put some extra thing on that.
Sir, so like you said, there are many different pain conditions, right? So in Ayurveda, like with any massages or any treatment, so how can people get relief from especially back pain, neck pain, shoulder pain or knee pain?
To understand this, we have to understand that fundamental principles. Okay, so we always say that pain is due to vata. So if vata is not there, pain is not there. Point number one. Point number two is that vata's house or where it stays. So one of the prime places where vata stays is skin. So skin is the site of vata. So if we have pain and if pain is increasing, one of the best way is to apply oil on the skin because it is directly attacking the vata. Some other things can be done later, like you can undergo a proper panchakarma procedure in a hospital. Like in Kapil Ayurveda also we do the panchakarma procedures. So you can come and do as per the consultation of the physician. But we have to ensure that we have to understand that in this particular season, one point which is very important to note is musculoskeletal problems. Okay, so anything related to the musculoskeletal system, it gets little cranky. Okay, so you will find the people are having pain in the knees, they have pain in the low back, pain in the neck, frozen shoulder pain is increased. Sometimes if you exposed to the cold wind, you will get severe headache. It will lead to cold and running nose. The people who have plantar fasciitis, like you would have seen people who are having the pain in the heels, that will increase. So it happens, one simple thing. Most of our houses are having now tiles. Okay, and a lot of people, traditional houses, people walk on these tiles barefoot. Okay, so what happens when you walk in the barefoot? The chillness from the tiles in the winter season actually affects your legs, so that stiffness comes, and when stiffness continues for some time, you get the pain. Okay, so there is a lot of small things which is happening in this particular thing. So people who are having musculoskeletal issues, they have to be specifically very careful. Musculoskeletal issues, some examples are like osteoarthritis is there. Any disc issues, spinal issues are there, like spondylitis or cervical spondylitis is there. Some other things like frozen shoulders are there, plantar fasciitis are there. So these kind of conditions you will find so pain will increase a bit. Also some other conditions like rheumatoid arthritis or some neurological conditions also, you will find the pain is increasing in the season.
So sir, when we speak about this musculoskeletal pains, so there is, like, I don't know whether it's a myth versus reality or something like that. So using Ayurveda, can they be completely cured or they have to be supplemented by the modern medicine? See,
it depends. Most of the time people try Ayurveda very late.
Okay.
So if you have a condition for say about, I'll just tell you one experience just couple of days before. One of my patient has called me and said that, sir, my mother is having knee pain and she wants to do an Ayurveda treatment. I said, okay, what can be done? I said, you send me the reports, let me check and then only I can give you an opinion. So he says, no, but surgeon says that immediately surgery, knee replacement has to be done, and we don't want to do knee replacement, so I'm doing Ayurveda. I said, no, no, hold on, hold your horses. Tell me first, what is the problem? Show me the report, then only I'll tell you. So he sent me the X-ray, and when I found the X-ray, there was no gap left. Okay, so as both the bones are totally joined, almost no space left. So in this Ayurveda, we cannot do anything. They have to go for a knee replacement only. Just imagine if this person has come to us 5 years before. We would have managed without any problem. We would have taken care of it. So most of the times people come to us very late, and then they said, no, Ayurveda is very slow. But because we get cases very late. If you get case immediately, fresh cases, you can solve it in very short time. I would like to give an example. Okay, we had our house help, and I'll tell you the very interesting time because it was in this time only. Okay, so she went to her house. Some function was there, some marriage, and while traveling back, she could not get train, so she came in the bus. Almost 6-7 hours of travel. It was cold winter, and she was sitting near the window seat. So morning when she reached, after some time, she found that her face is little distorted. Okay, so evidently it was a facial paralysis. She went to a doctor, and then they have given medicines, and they said something. So all the protocol she has followed. She spent some money. She's a house help, so she is definitely not earning much money and all. So medicines were very expensive, so she did not buy. So she came to work to our house. I said, what happened? So then she explained. So I just remembered that Ayurveda has told that if you are getting exposed to the cold wind excessively, it can lead to facial paralysis. We call this ardhitam. So I said, see, I can treat you if you are ready to do that. He said, sir, I don't have money to buy those medicines. So if you say something, I'll do. So I went to hospital. I went evening when I came back from hospital. I got her some medicines, and I instructed you take rest and do whatever I say. Don't change anything. So she has done, and within 5-6 days, her face became almost normal. Okay. Obviously, the whole society people went to her house. Oh, you come for work, because house helps are more important than anything else. So they actually forced her to come for work. But another 22 days, she was completely normal. Point is that she had the problem in the morning, and she started getting treatment in the evening. Okay, so she got treatment. Now imagine if she comes to me after 5 years. Can I do something?
No.
Yes. So that is the point we have to communicate. We are communicating with the people also, that certain cases, when we are talking about here about musculoskeletal or neurological conditions, try Ayurveda first. See, knee pain, it's not life threatening. Okay. The moment you get the knee pain, please go and see your Ayurveda physician. He will advise you certain diet changes. He will advise you some lifestyle changes, and he will advise you some oils and therapies. Do that, and you will feel better immediately.
Sir, so I don't know if may I ask this. So we have like certain neurological conditions. There are patients who have gotten strokes and all that, and then they may be immobilized at that point.
Yes.
So modern medicine also, after they're paralyzed, they give up at some point. So can Ayurveda restore their health, or can it help in their well-being?
For this, no, I definitely want to say I have 2 experiences, working experience in my life. I was working in a hospital in Coimbatore. My teacher, my guru used to be there, and he used to treat this paralysis cases. So there is a place called as Karamadai near Uti. So a lot of that village has so much of paralysis patients. 2 reasons: one, alcoholism; second, cold weather. So the moment they will get paralysis, they will put into the van, and they will come to our hospital. It was like that. And so I was fortunate to see many cases which was directly came to us. So which was manageable, we managed. Which was like fluctuating and need some stabilization. So I sent to my friend who used to run an allopathic hospital. So I used to send to her. So she will stabilize the patient and send back to us. So like this we have worked. Secondly, I also had an experience of working in an allopathic hospital. So in modern hospital, we were running the Ayurveda wing, purely Ayurveda wing. So there rehabilitation we used to do. So for example, a patient comes and the patient got stabilized with modern medicines, and then like physiotherapy they will do, they used to refer to us for a Ayurveda treatment. So what happened is with the help of physiotherapy and with the Ayurveda treatments, the patient used to recover very, very fast. Okay. So this is something which I think the authorities and the doctors have to consider. Is something called as integrative medicine, where you can use the best of everything and give the maximum benefit to the patients. Definitely that therapies works a lot.
So, I mean, a critical condition also can be managed with a combination of both the medicines.
I also had I have also have some few experiences of giving medications along with the modern medicines in ICUs during COVID. So because I was fortunate that I was working in a place where it was a modern hospital with an Ayurveda wing. So some point of time, one of my good friend, he's an intensivist. So he asked me one day, we were just talking, and he says, "Can you do something, because the patient is not improving, even being in ICU." So I said, "See, we can try if you allow." So he says, "I will send the patient's relative. You explain to them, and I think it's okay." So patient relative came and explained what we can do. Very simple medications we started giving. His oxygen saturation increased. Okay, he was not able to walk few feet even with the oxygen. He started walking few feet, and slowly he improved. So we continued, and both modern and Ayurveda together, and we have presented this case in our hospital panel, doctors panel also. So this is how the integrative medicine can work very well.
Understood, sir. So now if we see, like, there are some, like you said, immediate conditions, or there are some things that go on since years.
Yes.
So timely help is really important.
Yes.
So we have, like you said, those who are coming at a later stage, that is still not manageable, accepted. But if we see, knee pain is very common for people in old age. So many of them might not have contacted the doctors who are in modern medicine also, and Ayurveda also. So like you said, who don't want to go through unnecessary surgeries and procedures and all that. So can Ayurveda help? Like you have explained, and we have understood that it's still a point. But again, after there are cases where in modern medicine also they're not getting relief post surgeries also. So can Ayurveda help in that aspect?
See, it always depends on the condition. Okay, if the severity of the case is there, then we can definitely provide some relief. Okay, but it is only a level of relief. Okay. So in Ayurveda, no, I will definitely want to explain people, because few things is misconceptions. One misconception is that all the things which has been not treated in modern medicine can be treated in Ayurveda. It's not like that. We have 4 things which is explained. We say Sukha Sadhya and Sadhya and Asadhya. So medicine, the diseases, either it is cured or are curable or incurable. Incurable, it is 2. Either it is easily curable or curable with difficulties like surgeries and etc. And incurable has 2. One is manageable, like we have diabetes and other long standing conditions, and second thing is totally incurable. Okay, we cannot do anything in that. So in Ayurveda also which is explained. So the patient which is coming with any disease, which category he or she falls in, that makes a lot of difference. If a person is falling in the category of asadhya, incurable, even Ayurveda cannot do anything. But if he falls in the category of Sukha Sadhya, easily curable, you will get results within few days. So it is very important to which what is the case. So that then only we can say anything.
Got it, sir. So now if we see in this fast moving world, we have like issues that we have discussed previously also, like neck pain and shoulder pain, back pain. So there's something called frozen shoulder that's worrying people a lot these days because of the constant use of mobiles and screens and all that. So what's your take on it, and how does Ayurveda approach this condition?
See, frozen shoulder, you would have seen people who don't understand. Like if you raise your shoulders, you cannot go beyond this. It will start paining severely. You cannot raise hand like this. It just stuck here. Ayurveda has many medicines to take care of this. One of the very simple home remedy, I'll tell you. Okay, so it will help you. I am not saying that it is a replacement of proper therapy and consultation, but it is definitely going to help you. What you do is you take some lemons. Okay, so normal lemon, cut into the pieces, 4 or 8 pieces of each lemon. Like this, 4 or 5 lemons you take. Take a small pan, put some til tailam, gingerly oil, sesame oil, put some salt. Sandhava or Indup is good. Himalayan salt, pink Himalayan salt, and salt this lemons pieces, but just a little. Okay, and then add some coconut, grated coconut. So it will become like a bolus. Now this bolus you tie in a cloth. This has become like a kidi, we say, kidi or the pinda. Okay. Now this you heat in a pan and then apply the oil on your shoulders and give the heat with this. It helps a lot. It helps a lot, and it is something which you can do in your house. But if your pain is more, if your severity is more, please go and talk with your Ayurveda physician. In Kapil Ayurveda also we do these treatments, and it gives a significant response. Okay, so many cases we have seen of frozen shoulder which has improved significantly within 2 to 3 weeks.
So we have spoken about frozen shoulder now. So many people are also suffering with pain in their heels right now, especially it becomes worse in winter. So what are the treatments that can be offered for this sort of pain?
Okay. Pain in the heel is usually due to two things. One is plantar fasciitis, where we have the inflammation, and we also have something called as calcaneal spur, when the bone, there's bone growth is there. I blame to few things. Okay, one is walking on a cold floor. So most of our houses is having tiles, and in the cold winter it becomes very cold. And I also blame to high heels. Okay, so we have seen many young girls who having the pain in the heels. So because they walk on high heels, so that creates a problem. Now I'm not saying that don't walk on high heels. I'm not against fashion, but you can actually prevent it. So one of the easiest ways there, like I told in the last episode also, that you have to apply oil in Shiraha Shravana Padeshu. So you apply on the head, in the ears, and the feet. So if you make a habit of applying oil 2 times a day, like morning before bath you just apply the oil, and before going to bed also you apply oil on your feet. If you do this regularly, it will take care of your feet muscles and you will not have any issues. Secondly, you can use some slippers to walk around in the house. Third, if you are standing for long time, suppose you are cooking few hours, you have to stand in the kitchen, use anti-fatigue mats or some soft PVC mats. So you stand on that, so that strain does not come to your legs and you will not have the pain.
Sir, so like you have explained, either coconut oil or sesame oil. So
in pain, sesame oil is better.
Okay.
There is a researchers are also in that. So if you have pain, sesame oil is better.
Okay. So other than that, we also have some medicated oils, right, sir?
Yes.
So I mean, these days, if you see, there are many stores that are selling medicated oils, like pain relief oil for knees and feet and all that. So do you think it's really safe to buy these oils off the counter, or just take the prescription of an experienced Ayurvedic doctor?
I want to mention two things here. One is most of the oils are they contains menthol and other ingredients, wintergreen oil and etc. These are not therapeutic. These are called as counter irritants. So it will irritate your skin, and you will feel, your neurons will feel that the pain is not there. So it is like fooling your nervous system.
Okay.
The proper medicated oil, what they do, it actually get absorbed in the skin and it takes care of the pain. So they are two different things. So this painkiller oils, what you're getting in the market, it is good for temporary relief. I'm not against that. But for a longer run, for treatment, it is always good that you go and talk with your Ayurveda physician. See, reason is that suppose you have a knee pain. Okay. Now, knee pain can be due to various reasons. It can be osteoarthritis, it can be weakness of your muscle, it can be rheumatoid arthritis, it can be some other pathology, it can be some neural pain, and anything can happen. So, physician only can determine that what is the cause of your pain, and then he can advise you accordingly. So, those medicated oils, it is always better to talk with a physician and then take. One oil, I think it is mostly harmless, is called as Dhanvantaram Thailam. So if you are very particular, you can use this oil, but if you find any difficulty, please again come to us.
Got it, sir. So what message would you like to give your audience, especially in the winter seasons, on steps to take care of themselves, or approach their conditions that are that have been there since forever using Ayurveda?
Okay. Because we were talking about therapies,
Yes.
I want to tell two important things. One is that not everybody can apply oil. Okay. But oil is also a part of your day-to-day life. So in Ayurveda, we have something called as Dinacharya, as I explained before. So there it says, Abhyangam Acharet Nityam, Sa Shrama Jara Vataha. So Abhyangam means self-application of oil should be done every single day. And Jara Vataha, it reduces the Vata and it postpones the aging. See how nice it is. So if you apply oil every day, you can reduce your, you can reduce the cost on longevity, like we are to look younger. Okay, so that cost can be reduced. And this oil applications, if possible, if it is feasible, you should definitely go to some therapy centers and do massages there, like once in a week, once twice in a week, or whenever you can. So that will help you a lot in order to take care of your day-to-day life. And second point is that you have to take care of yourself through winter cold things. Okay, so suppose you have applied oil and you go and sit inside in the cold wind, or you sit under the AC, so the pain will increase. Okay, so you have to follow the proper protocols for this. Best method, I will simply advise that get up in the morning, ensure that you are applying oil on your head, ears and feet, at least, if possible the whole body. Leave it for half an hour, and then bath with warm water. When you apply oil, ensure that it is warm, it's not cold. Okay, at least do this, it will change your life.
Thank you so much for being on our show, and thank you for all these valuable advices. Hoping to see you soon.
Thank you, ma'am. Thank you so much.
Thank you so much.